welcome to this session this morning, which we're going to be looking at criticality in terms of the evidence. So how do we critically appraise the evidence that's out there? And again, we're going to cover a whole range of different things in this session. So I make apologies that we are going to, it may feel somewhat in terms of a whistle-stop tour, because in terms of your backgrounds, in terms of your current understanding, what you're currently working on, how you're dealing with or working with the evidence. So I'm covering a whole range of different things. And one of the things I'm going to ask you to do is, before we go into the breakout room, so start doing this now, is just putting in the sorts of things, the questions that you've got in terms of why you wanted to come onto the session, but what you're looking to try and be able to find, whether it be a particular tool or just some broad understanding or some particular aspects. That'll be really helpful to me, so I can make sure we cover that, or if not, I can pick that up afterwards. So my name is Catherine Hinsliff-Smith, and I'm Associate Professor and a Deputy Director for the Institute of Health Policy and Social Care Research down at DMU in Leicester. But I'm also as well work for the University of Nottingham, and I worked there for over a decade. And the last 15 or so years of my career has been heavily involved in healthcare research. And I am a qualitative researcher, is what I used to always say to people. Yes, definitely, I'm definitely into qualitative research. I'm not involved in RCTs or quantitative methodologies. However, when I come to reflect on that, I've been involved in a number of RCTs. I've also been involved on mixed methods studies as well. So I'm hoping I'll be able to bring a broad range of perspectives. Some of the tools and some of the things that we're going to go through, I haven't used personally, but again, these are opportunities for you to have a look at the different tools that you might think are appropriate for what you're wanting to do. I am on Twitter, so if you want to follow me or write anything on there about the session this morning, I'm more than happy for you to do that. And also my email address is on here, so please feel free, if need be, you want to follow anything up. So without further ado, this is what we were aiming, this is how we promoted the session, in terms of, we thought there was a need really just to help you in terms of how to critically appraise the evidence that's out there. So again, as I said, it's going to be quite broad. We're going to cover a range of different topics when we come to think about reviewing the evidence. But I am only going to be talking about healthcare. So if anybody's joined this morning that is thinking it's something completely different, we wish you goodbye, because clearly it's not the right session for you. So we are going to talk about healthcare. I am going to touch on and give you some tips about the grey literature, which we know within healthcare is something that does play a part in terms of the evidence. And we're also going to talk, or I'm going to give you some tips and some work around predatory journals and what we mean by preprint material. So again, some of that may be jargon to you at this moment in time. Some of this you may be very au fait with. So the format for this session, what I'm intending to do, and again, there is some flexibility, but I think the 2 hours will quickly whiz by, is I am going to just start us off thinking about, well, what is the research process? What is it that researchers are having to do, or what should we be doing in terms of the research process? And I know we've got colleagues here on today that actually are researchers, so they're actively involved in research. There may be research nurses working in clinical practice, they may be undertaking a PhD, for example, or they might be working part-time and undertaking a dissertation as part of the master's. So we've got a whole range of people that are on here today. I am going to touch on ethics, and you'll see why shortly. I am going to talk about some tools, and I'll say to you that's 4 slides of tools. There are a plethora of tools that are available to help you to critique the evidence that's out there. So we're going to have a look at some of those. I'm also going to talk about reviewing reviews, and in terms of what we do when we come to read those systematic reviews, or a scoping review, or a literature review. We are going to touch on the grey evidence base, and I'm going to talk about predatory sources. And I'm hoping there'll be opportunities for some questions as well. So again, please put those things in the chat function. If you can put in, first of all, though, about the sorts of things that you're wanting to get out of the session, that will definitely be helpful. And then in your breakout session, so I've built in a couple of breakout sessions, chance for you to network with other people, but actually then kind of just share some of your own knowledge and pass that on to your colleagues, and then we can come back in there. They're only brief sessions, so you won't be disappearing for 30 minutes or so at a time, but it'll just give you a chance just to, rather than listening to me for the next 2 hours, it'll just break things up for you. So who am I? Well, I'm here today wearing many hats. So yes, I'm an academic. I teach research methodologies both at Nottingham and at De Montfort University. I am also an active researcher. So I have a portfolio of research that I'm undertaking. I have 2 strands of interest. One is around older people with a particular focus on care homes. And the other strand of work is around gender-based violence, domestic violence. And that work takes me not just within the UK, but also I've been looking to work in Brazil with some very valued colleagues out in Brazil around the care of older people, but also with colleagues in South Africa and also some European colleagues as well. So I've got quite a large portfolio. I am also a colleague. For those of you that are at Nottingham, I'm a colleague because I'm a member of staff working at Nottingham. I do quite a lot of mentoring, again, so I may have crossed paths with some of you. I do deliver teaching. I'm also an accredited systematic reviewer for Joanna Briggs Institute, JBI, as we abbreviate. And please pull me up if I use any abbreviations that you don't know what they are. I've tried to make it an acronym-free zone, but things do slip in. JBI, some of you may be familiar with Cochrane. So again, a systematic reviewing suite of tools that enables you to conduct systematic reviews. And I'm an accredited, not just a reviewer, but a delivery of the programs so that you actually have the tools to be able to undertake that. And I'm also a journal editor. And that is really useful, particularly for this session, because what I'm going to talk about is when I've got my journal editor hat on, is the types of things that we see submitted to a journal. So I'm the editor for Nurse Education in Practice, which has got a impact factor and also is international and it's peer reviewed. So I'm going to slip in there some information around some of the things that we see as journal editors, which hopefully you, when you come to either publish your work or you're reviewing published work, that will help you to know that actually that sense of confidence that there's been a process that's been gone through for that to get published in the first place. So let's just think about the research process itself. Often when I speak to students, undergraduate students, and they'll say, oh, you know, I want to be a research nurse, or it's really what I'm interested in, but I'm not sure about the processes. And I'm sure that for those of you that are online today, research is not linear. You know, we don't plan it and say, well, this is the problem, we're going to do this, this will be how we do it, and then that's the end, and everything goes hunky-dory, and it's in that sort of process. There's lots of different curves and turns in terms of conducting research. And I'm sure that for all of you that have been involved in some aspects of research, you know, it's often intuition. You know, you're on a ward or you're in a clinic and something you think, well, actually, I'm interested. Why are we always using this method or this approach or this type of treatment? Or it might be the fact is that there's a funding call and that drives, you know, you kind of thinking, well, actually, that's some research that I'm actually interested in as well. So I want to apply for that grant funding. Or it might be some form of a service evaluation or an improvement. So again, different reasons why you come to thinking about research, but also thinking about, well, actually, how can this research help you to understand what the need is, what the issue is, the problem, etc. And of course, from your point of view, if you're looking at the evidence as is, what you're looking at is that they've already gone through all these processes, but also you want to be able to see the justification in the background of the evidence they're presenting as to why there was a need, why was this research, and why these people to conduct this research. And that's something when you come to review the literature that you're wanting to be able to see. So it's great to be able to say, well, we've done this really neat piece of work. Yeah, but what's the value of it? What does it add? What does it tell us? And also, particularly thinking about as an international journal, we often get very small scale studies, and that's not to devalue the value of a small scale study, which might be a quality piece of work, and it may involve, you know, some interviews in a particular clinic. There's nothing wrong with that, except what relevance is that to the international readership? What difference does that make to the wider population in the country? Or is it just something that's very localized? In which case, obviously, you need to be thinking carefully, well, where would you publish that? What of interest you? So you've really got to build in there. What is the need? What is the issue? And why has this research been conducted? So again, already when you start to read the evidence, and I'm using the term evidence predominantly in the terms of published work, whether it be a funder's report or a journal manuscript or an article. It's that sort of evidence that predominantly most of us are aware of and we come across. So again, you want to be able to understand that. So what was the significance? Why did they conduct this research? And often we reject papers because it's just not clear. It's a very localized study, which has no implications for changing practice outside of perhaps that very small locality. So again, you need to be looking for that within your, not just the title, but in the abstract itself. Is it clear to you why this research has been undertaken? Okay, and then obviously the research team would then want to think about, well, actually, yes, there is a justification there. We do need to do research. So how can we go about the research activity? What do we need to do in order to answer or to be able to identify what this issue is? And again, that'll be talking about, you know, the methodologies, the different research design approaches. And again, those are the sorts of things that you'll be reading in the evidence. Okay, so how have they gone about that? And in your view, is that the right approach for this? Okay, so if you want to know about patient experiences in a clinic, yes, you might send them a survey, but actually, if you really want to get to the nub of what it's like for those patients, you'll be wanting to do some interviews or something similar. So again, is it appropriate the way that they've gone about conducting that study that resolves back to what is the issue, what's the gap, what is it that they're trying to identify? Again, I've wrote up here ethics, and we are going to do a task around ethics shortly, and I'll explain to you a little bit later why I think that's important that we talk about that. But also, you know, there might be some timescales. You know, is there funding available? How might you go about it? What have they done? Obviously, if anybody's publishing their work, they do need to declare whether they've had any funding for it. Not only the acknowledgements, but also in terms of where that funding's come from and any involvement of the researchers. So let's say we're testing out, we've run a randomized control trial, an RCT, and it's used a particular drug, and I'm the chief principal investigator, and I'm also employed by the drugs company. Now, you'd obviously want that to be declared because I may have a bias towards that particular drug. So again, those are the sorts of things that when you come in to look at the evidence, you absolutely want to be able to see and to be clear about that, and that has to be declared. And in fact, for most reputable journals, then you absolutely have to declare that at the very outset. It is a requirement when you come to publish any studies. And I'm just going to move my little box here because it's right in the way. Oops. Just go back onto my presenting. I've lost my screen. I'm sorry about this. Where I was talking, that's it. Okay. And again, do you have capacity to actually undertake this study? Okay, so that's not about when you're reviewing the literature, but this might be your own perceptions. Okay, who have we got to do it? When can we do it? And what are the timescales that we're working to? So obviously, I'm sure that all of you are aware of that, but these are the sorts of things that you'll be wanting to pick up when you come in to review the evidence. And sometimes these great ideas, I mean, I've worked on studies going back to 2014 when we had some interest around Zika in Brazil, actually. And again, you know, these sorts of burning questions, there were, you know, some of these things do take a long time. I often refer to it as a slow burn, particularly when you're talking or working with colleagues that are working in very different contexts to yourselves. They're actually, we're very fortunate in the UK, other than the last 2 years, that, you know, there's a range of funding that's been available for us within healthcare. So we've been able to quickly think about those questions, develop those questions, develop them into proposals, and to undertake that research. But that isn't always the case. So don't lose heart if you're thinking of undertaking some research and it kind of keeps getting putting on the back burner, or in this case, it's just smoke without any fire, you know, because actually those ideas often help to permeate and then will come through. But of course, we know that sometimes actually getting the evidence out there is absolutely paramount. You know, we only have to think about COVID or Ebola or Zika. You know, these are things, you know, the new boys on the block that suddenly come and have a massive impact upon us. And in which case you need to get the evidence out there quickly. But likewise, it also needs to have that efficacy in terms of the quality and the standard of what's being delivered. So, in terms of critiquing the evidence, again, when you come to look at whether any form of study, but you want to know what's out there currently, we do what we call a critical appraisal. So again, thinking about, okay, what are the tools, which is what we're going to talk about in this session, what are the tools that are at hand for us, our toolkit, that will help us to critically appraise either the evidence that's out there, or also that we can use to ensure that actually we're following some structure in terms of our own research and also the dissemination of that research. Because of course, if you've conducted a study, you've then disseminated it in various forms, whether it be at conferences or as a journal article or in reports, etc. You also want to be able to stand up for scrutiny. So again, often these tools you'll use within your own research to demonstrate that you've gone through a structured process. So that means in the future, when somebody's looking for the evidence and comes across your work, they have the confidence that you've actually done it in a methodical and critical way. So again, there's lots of different sources, but I particularly like this one by Duffy. So it's an objective, structured approach that results in a better understanding of a study's strengths and weaknesses. Now, we can all be critical, and we can all look at a journal article and think, that's interesting. I wonder why they didn't do this, or, oh, it's such a pity they didn't look in this particular area. Most studies will have strengths and weaknesses, and often you'll see that within journal articles as limitations. So again, that will allow the authors to identify, well, actually, yes, you know, on reflection, it would have been helpful if we'd done this. Perhaps, okay, we were only able to recruit in a particular 3 clinics, and we really wanted to get a broader range of views across more clinics than that. And again, that's where, you know, they're identifying that, you know, the best will in the world would like to have, you know, covered all of this, but the reality is in research, you know, it has to be fluid often. Okay. Obviously, what you're looking for is different sorts of weaknesses, which are structural weaknesses, which clearly then undervalues the value of that particular those study findings, and that's obviously where we need to be doing that criticality. And again, obviously, you don't have a section in a journal that'll say these are the strengths. The strengths are the fact is what they're publishing, what they're actually sharing with you. Okay. So there's no consensus, you'll be pleased to hear, well, or perhaps not pleased to hear. You would like to say, right, this is one tool, and this is the one tool that I use, and this is going to assess all of these different studies that I'm going to come across. But you can imagine that actually there isn't one definitive tool, because it depends on the type of study that's being conducted, in what context. So there are a range of tools that are available, and again, I'll share these slides with you afterwards because there's lots of hyperlinks in here for you. But again, there is this on PubMed, they have a range of different types of healthcare tools, the common tools that you could use to assess the quality of the evidence that's been presented to you. So again, it will depend on the different types of study designs, what it is that you're trying to do. Is it a review that you're trying to conduct? In which case, is it going to be looking at just qualitative evidence, or is it going to be looking at mixed approaches, or what is it that you're trying to do? So again, you need to have a look at that. So to critically appraise a journal article, you would have to start by assessing the research methods, which is what I've just said. So you're looking at, you know, you wouldn't necessarily try and clump together every type of research design that's being conducted in the world. That would be such a broad area. So what you want to be doing is to identify what exactly is it that you're wanting to do. So you're setting up your stall in terms of what is it that you're trying to identify in terms of conducting this appraisal. And again, there are various checklists, and I'm going to go through some of these with you in a second. So I am going to talk about ethics. And I can't see your faces at this moment in time because I've just got my screen up here. But I am going to talk about ethics. And I'm going to talk about ethics because one of the things in terms of the research process and in terms of the critiquing the evidence that's presenting to you in terms of its value and its worth and its trustworthiness is actually, has it received ethical approval, favourable ethical approval? And is that clear within the evidence that you're reading? And you might think, well, that's obviously fairly obvious. Nobody would publish their work if they hadn't conducted ethics, surely. Well, you'll be really surprised, even within the UK. So particularly, and I'll put my journal hat on, editor hat on here. We have in excess of 1,000 submissions a year. Now, we're a small journal compared to somewhere like the Lancet, say, for example, or BMJ. So you can imagine how many submissions that get sent to them. And of that 1,000 that we get, just over 1,200 last year, of that, 80% of those we reject at desktop stage. In other words, when they get submitted, they don't go out for peer review. They are reviewed internally by the editorial team. So we look at those and decide, actually, first of all, do they meet the aims of the journal? Does the work that's being conducted, does it seem ethical? Have they followed some set procedures? When was this study conducted? So we do that, and we reject 80% of those submissions. Now, they're not all down to ethics, but certainly that is a large aspect. So again, if there's no mention or no evidence of ethical procedures that have been undertaken, then we would just return it, because again, we're not going to go through the process of peer reviewing it to find that actually this study is a spurious study, or it's not being conducted in line with ethical guidance and principles. So again, these are sorts of things that you're looking for when you could. That doesn't mean that every article that you're going to see has all been through the same process, and we'll talk about that a little bit later when we talk about the range of different evidence, particularly the grey literature, but also predatory journals as well. So it is something that you do need to be aware of. And I want to talk about this briefly in terms of post-COVID, because we're aware, I'm making a wild assumption here, but I think most of you are involved in some healthcare related aspect. And in which case, we're aware that during COVID, obviously, most, if not all research to be undertaken was put on hold for obvious reasons. And even now, we're only getting that slowly coming through. So I have undergraduate students that are currently not allowed to undertake any research, for the simple reason that obviously we're still recovering from COVID within our clinical areas. So I'm just going to talk about in terms of post-COVID. So again, you'll need different types of ethics depending on the research. And this is what you're wanting to be looking at within the evidence that's being produced. So what type of ethics have they gained for this study that you're reading? Okay, and just turn it flip side, thinking about your own research. So again, I'm aware that some of you are actively involved in research, or perhaps considering conducting your own research studies. You need ethics needs to be for anybody, whether it be participants or samples. You will need to gain some form of ethical approval. And again, that will depend on a number of factors in terms of the types of participants or the samples that you're wanting, where are they, whom with it, when is it, a whole range of things. So again, that's where you need to get some further guidance from your own institutions and the type of work that you're doing. So I'm just going to check. Does somebody want to say that you I can't see anybody's faces now because I've got this on here, so I'm assuming that everybody is still with me in some capacity or another. Okay, so what I wanted to just briefly show you is 10 examples of the different types of studies that we might see, whether it be in the UK or whether it be overseas. But this might be different types of studies that have been conducted where you now seen the evidence and you might be reviewing the evidence that's been presented. So there's 10 different types of examples here, of which they'll all need some form of ethical approval potentially. So it's kind of, well, what type of ethical approval? We don't have, I'm not going to make you go into groups for this, because I'm going to share with you I'm going to share with you the answers, if you like. But you can see on here, there's a range of different types of research that might be undertaken. So whether it be around long COVID within a GP practice, it might be an international study, It might be an RCT, which is being conducted here in the UK with NHS patients, but also then you're going to transfer it over to another country. So again, there's different implications depending on the ethics. And the reason that I'm sharing this with you is because when you're reviewing the evidence, it's really important that you're aware of this and that you're able then to think about that and be looking to see that. And I'm going to show you a live example a little bit later of where this became quite an issue for us. So in terms of thinking about the different types of ethics, so for these three that have come up here, number 1, 2 and 3, you will require institutional, and I'm using university, ethics. You will also need to apply for IRIS and REC approvals prior to conducting these studies. And that's because you're dealing directly with NHS patients or staff. So again, you know, the first one you wanting to talk to NHS midwives, it doesn't matter whether it's a doctoral study or not, you will still need ethical approval. So that when that person then comes to publish that work, then obviously that needs to be clearly identified, not just only that they've got ethical approval and a number, but the process that they went through in terms of recruitment and handling the data, etc. Again, RCT, a randomised control trial. Again, in this case, you know, you're dealing with patients, is obviously you're going to need to have some ethical approvals. And likewise, a GP practice, you know, yes, based out in the community, but still governed under the NHS. So you will need the full gambit of ethical approvals, and that's what you need to be seeing within the evidence. Secondly, this may be where we have got a doctoral student, but their setting is very different. It's not within an NHS setting, it's working directly with private care homes within an area, perhaps even working with a charity. Again, that makes no difference. Okay. The slight difference to that would be, let's say that within that they're going to be interviewing the care home managers, but also they're interested in interviewing the healthcare professionals that come in and provide the care to the residents within a care home. You're now involving NHS staff. So again, that would then need the full gambit of ethical approvals. So again, it really depends on the type of study and what types of participants and where you're conducting the study. Same with a survey. So again, I've got colleagues that have conducted quite a range of surveys, particularly around people's experiences of COVID and things during the pandemic. And again, even though you're asking them about a particular service, an NHS service, for example, then again, unless you're actually interviewing the patients within the setting, or you've been referred to those patients, then you could just have the university ethics. In terms of the next two that I've put up, again, it would very much depend on the nature of the study. So it's not a foregone conclusion. So an undergraduate student and it's a dissertation project for a module. Again, you wouldn't be suggesting to that person that they're going to do a full systematic review. They're on a module, it lasts for 10 weeks. You know, it's going to obviously be something small scale. You're not going to want to be able to get them to do something that's going to need full IRIS approvals, otherwise they'll run out of time. So again, different variances, and again, that's when you come to, if that work was then published, you'd want to be able to declare that and demonstrate that actually they have undertaken an empirical study, say for example, and actually they got internal ethical approval at the university, say for example. So again, you'd be looking to see that and the work and the type of work that they're doing. Number 4 on here, so this relates to number 2 in the sense that, you know, you're running a randomised control trial, you'll need full ethics here in the UK, but you've decided actually that your colleagues in Brazil also want to be an arm of this particular study and use the same drug within Brazil, in which case it will be your Brazilian colleagues, or wherever they may be, that will need to apply for ethics in their own country as well. So again, you know, our ethics here in the UK covers us here in the UK. But again, if you're wanting to take it outside of that context, then you would need to apply for ethics there. And those are the sorts of things that you'll want to see within the evidence. So often we see the journal that I'm involved in is around educational practice. in nursing and midwifery. So often we may see studies where they've done cross-country types of work, and again you're wanting to see evidence that ethical approval has been gained in each of those settings, and how then that was delivered and how they ensured that ethical procedures were followed in each of the different countries where this study was based. And then thinking about where you don't need any ethical approval. So say, for example, if you're reading or you're conducting a systematic review or a scoping review or a literature review, then regardless of the topic, then you don't need any ethical approval. So that would be just something that would be blank. You wouldn't need to do that. And similarly, if you were involved on a study, and I'm using this example on number 8 because this is something that I'm currently working on. I've got South African colleagues that have got a grant. They're completely conducting all the work in South Africa. They are conducting all the data. They're collecting all the data, rather. They're doing all the analysis. And in which case, I have no direct involvement with the actual the data handling. So I don't need to obtain any ethics here in the UK. Obviously, I'll be wanting to see the principles and how they're running that study. But in terms of ethics, I don't need any ethical approval here in the UK, unless, of course, that was a doctoral student that was, say, perhaps studying at Nottingham or DMU and was undertaking their doctoral study by conducting work in South Africa. They will need ethical approval here in the UK, usually the university, and then also once they've got that, they will then need to apply for ethical approvals over in the country where they're conducting the actual collection of data. Last but not least, I put this in grey because it's a bit of a grey area in terms of a service evaluation. But again, if you're involved at that level and it's something that you're not sure of, please contact your local sponsor who will be able to advise you whether the type and nature of the ethics that you will need if you are doing some form of a service evaluation, perhaps of a diabetes clinic that's been running for a number of years or months, and you want to just evaluate how that is. Okay, so I'm hoping that kind of gives you a perspective in terms of the different types of studies that might be undertaken that you then come across in terms of looking through the evidence. And I use the term there, sponsor, and again I've just put this in mainly because I'm not sure of what level that those that are on the call today are at, but in terms of the sponsor, we talk about that could be someone in your institution or your clinical area or your trust that has the responsibility for the research governance in terms of all the research that's conducted within your organisation. And if in any doubt and you're not sure what type of approvals I need, I know it's within the NHS, but I'm really just not sure what sort of process I need to go through. These are 3 really useful hyperlinks. And again, you'll have these later on that will just help you a quick checklist, which allows you to see the type of research you're doing or you're proposing, and then what types of approvals do I need. I use the term IRIS in terms of an integrated research package online, which we use for any work that's conducted with NHS patients and service users. Now, you'll get an ethics number through this, and that's what you'll want to see as evidence. So most journal articles, if they're publishing, will need to not only give the ethics and what they've got, but also the number as well. And in fact, I've currently got a paper in with BMJ, and they're specifically asking for the exact number and date of the ethical approval. So again, more and more tightening up of requiring that. So again, if you're not sure or you're not familiar with IRAS, then again, there's some links on here. But I'm sure that most of you that are working within healthcare settings are aware of this, and there's people around within organisations that can help you with this. Obviously, if you look at the international literature, they don't have an IRAS. And the paper that you're reading may not have on a number. That doesn't mean that they haven't got it. What you're looking then for is actually, they have included, they've got ethical approval, perhaps with a date or where it was from, but also then the processes that they've got through. So we don't discount the evidence if they haven't actually listed a number. It's just something that within the UK that we have, but also the journals, many journals now are requesting that information. And they'll pick up, if it's UK, then you should have some various numbers. Okay, so before we move off ethics, just to give you, for those of you that have not had gone through this process, you know, once you've got your ethical approvals, that number will appear on absolutely everything. So you'll have that, as I've just mentioned, in the journals, but any funders report, on all your consent forms, absolutely everything. And again, any amendments, there's a procedure to do this. So again, a little bit more than perhaps critiquing the evidence, but actually it's fundamentally something that you would want it to be looking for. Okay, so breakout session. I'm conscious I've been speaking for at least 20 or so minutes. So what I'd like you to do is we're going to put you into some breakout rooms, and that's where Alice is going to come in. And what we want you to do is to think about these questions. So if you want to just quickly draft these down, that's fine. So what we want you to think about in your groups is, why do you think it's helpful to know about ethical approvals? What should you be seeing when you review any evidence in relation to ethics? So what is it that you think you should be seeing? But also, when you've reviewed the evidence, have there been any queries, anything in particular that perhaps you thought you should have been seeing, or wasn't there, or was there and it seemed a bit odd or strange? But also taking that step further, what can you do about that? Okay, so there's nothing in this journal article that tells me anything about ethics and ethical procedures. So what can you do about it? And then before we move on to the next section, what is the position for journal publishing of research? So what do you think, how do you think journals handle in ethics within publishing of research?
Sorry. Yes. The first question, we talked about why is it helpful to know about ethical approvals? And you know, generally the idea is you want to be sure that participants and patients were treated properly, were safe, they weren't put in harm's way in any of the research procedures, and that there was the research followed the proper procedures, you know, maybe going by their protocol or whatever. You want to be sure that that is evidenced by the ethical approval. And then what should I be seeing when reviewing evidence in relation to ethics? 2 points came up. Looking out for the IRAS number, which we heard from you this morning. And somebody mentioned that some, studies describe the way the patients or participants were consented. So that, is also evidence of going through proper ethics. I think that was as far as we went before 10 minutes was up.
All right, okay, that's brilliant. Thank you so much. Here's your virtual round of applause for coming out first. Thank you very much. Does anybody just want to follow from another group, either with the other questions I posed or add to what has just been nicely delivered there? Got a second brave soul. I can't see everybody on my screen, so just unmute yourself and just talk rather than being invited to talk. Okay, all right, okay, so a couple of things there. I've looked through your questions, that's good. So it looks like we're all on the same session for the same reason, so that's always very helpful. But also you mentioned there about IRAS, and I mentioned earlier, obviously in other countries they won't necessarily have what we call IRAS. That won't mean anything to them. So please don't be thinking, oh crikey, I'm just going to discount this study because they haven't put a number in or they haven't cited IRAS. Okay, and again, it's been, what you need to be reassured of is being through, in most cases, and again we'll talk about this later when we talk about journals, a peer review process. So other people have reviewed this, including the ethics, including the study, how it's been presented, etc. Okay, your role in terms of reviewing the evidence is not to suddenly contact the authors and say, I want a copy of your consent forms and I want a copy of your patient participant information sheet. You're not going, in the best way in the world, A, you haven't got the time to do that, and secondly, that's not what your role is when you come in to review the evidence. You can only go with what you've got presented to you, which in most cases is a 5,000 or 6,000 word journal article. You're right though about the procedures. What you want to see, and often again, I only bounced one yesterday, interesting enough. I use that in a nice term, by the way. We don't write them an email saying, by the way, I'm bouncing your manuscript. But, you know, the fact is that, you know, they might have just talked about, well, we got consent, full stop, and then they move on to tell you about the findings. Yeah, but how did you consent? What was the procedure that you followed in order to engage with those participants? You know, and part of it, they can't write as much detail as you always would like to see, because most journal articles, you know, 5,000 to 7,000 words is the norm. So they're not going to write down absolutely everything in terms of how they went about it, how they did. But you want some sense of feeling that a procedure was followed. And often I get this with, particularly where we've involved students within clinical practice. Well, you know, what we did is we got them in on their module and then we got them to evaluate at the end. Well, did they have much choice? Because these are the students that need to pass the module. So where, you know, what, under what duress were they felt they had to be a participant, etc. Okay, so again, it's those sorts of things that you're wanting to delve into. Okay, so you need to see not only have they got consent, but how did they get consent? How did they proceed to anonymise the participants? How did they think about withdrawals? What if anybody said, actually, I've decided I don't want to be in this study anymore? You know, all of that information is the sorts of things that you want to get a sense of. It might not all be in there, but you want to see a sense of actually how was it conducted? That's what you need to be looking at. So don't get thrown off that they don't have absolutely everything, but you definitely need to see something in there. So let's just have a look at the other questions that are posed as well. Let's just chat about the. Can you all see that PowerPoint? Yes. Can somebody just can somebody just say, yes, you can see it still?
Yes.
Yeah, we can
Brilliant.
see it.
Okay. All right. Okay. So yeah, you do need to know about ethical approvals, because that will help you to evaluate the standard and the quality and the procedures that have been conducted in this evidence. So you do need to know that. Okay. What you should be seeing, I've just gone through, you know, any queries. So I'm just going to share with you. I was part of a team with 10 academics, 6 based out in Brazil, 4 based in the UK. And we were conducting a systematic review of a particular, to do with care of older people. Actually, we're interested in finding out different tools that were used within Brazil. And one of the things that we very quickly, and we weren't intending to do this, so we divvied up all the, so all the data being searched, we'd got a big bank of evidence, and then we divvied it up, and we were looking for English, Spanish, and Portuguese language, and we're also looking at the grey literature as well. Anyway, we got all that together, and one of the things that we just kind of stumbled along, and then I think actually it could have been me, because ethics is something that I'm particularly kind of home in on, and I said it's really interesting. And what we were able to identify is a lot of studies made no mention whatsoever about their ethical procedures. There was nothing in it. And what we identified is that some of the journals where they were publishing were highly reviewed, no issue with the journals, but it wasn't something that they included as a requirement. And what we found was in Brazil, they don't necessarily have that requirement on their journals. And so what we did is we didn't discount any of the evidence. What we did is when we reported it in our review, we identified that said, you know, a percentage, we saw no evidence of them citing ethical procedures. Okay, so we weren't discounting it and saying actually this study must be absolutely rubbish because they haven't mentioned about ethics, but we were noting it that it was an aspect. So it might be something that, again, that you come across when you going through your papers, etc. Did anybody have any discussions about journal publishing and what we do within journals? Or did you not get that far in your 10 minutes? I'm assuming you didn't get that far in your 10 minutes. Well, that's okay, because I've got a slide on it anyway, so that's fine. Okay, so if it's okay with you, I'm going to proceed. So let me just move that. Okay, so in terms of principles, yes, there are clear principles that what we want to see is that your participants, your patients, that we deal with them within a procedure, within an ethical understanding in terms of how we deal with them as individuals, but also their data. You know, that data they need to feel assured that we are handling their data, whether it be interviews, whether it be their medical records, whatever it may be, that we're actually following some principled guidance. And as I mentioned earlier, in terms of having no indication of approvals, okay, what you should then be thinking, okay, so it's got nothing mentioned in here, but also I'm a little bit concerned perhaps about they've just put one sentence in, we recruited participants from a clinic, full stop, and then they've gone on. I would start to be questioning that, okay, and just then looking at perhaps the journal, what type of journal it is that the normal format for this type of publication in this journal? And just doing a little bit more digging around in terms of why is that the case? And it might be that actually there's an understanding that actually that's a given, and that they're not required to put it in any more than that. There's not many journals, and again we'll talk about predatory journals and other journals. So again, it's just thinking to yourself, okay, that's interesting, it's not in there, I wonder why that might be, and then just do a little bit of digging about other articles from that particular journal, and also within the broad topic area. Okay, is that the norm within that broad topic area as well? Obviously, as I gave an example, if there's very little or no, or there's inconsistency when you're reading a paper, then certainly alarm bells should be ringing, and then either you or your group or whoever is reason for looking at this would need then to think to yourself, okay, do we discount this evidence because of this inconsistency, or would it make no difference if we included it in anyway? And those are some decisions that you make collectively as a group, okay, and decide from there. One thing I will share with you is I was conducting a review with some colleagues. We were looking at dementia out in sub-Saharan African countries, and we were particularly interested in any support that had been given after a diagnosis of dementia or Alzheimer's. And what we did come across is the same team of researchers that appeared to be replicating I'll use a different word. The same team were authors on a lot of publications, and it was only because we spotted, actually, well, that's an unusual name, and then we realized that within our database of all these hits that we'd got that we were thinking of including, the same team, and what they'd done is what they call salami sliced. In other words, they'd done a study and then it's divvied up all the different findings from that one study. So rather than having one journal article that reported the findings, they had about 8 different articles all relating to the same findings. Now, they were all published in different journals as well. So again, journals and handling editors all have different things in place to be able to stop that, because we can check whether there's a similarity of authorship, similarity of title, not the similarity of the work. This work that was being published, we were looking at, was published prior to 2000. Not that that's a significant date, but I'm saying it's quite a while ago. That doesn't mean that you might not come across that, because clearly things like salami slice, and again, I've not put it up as a reference, but I can send it later to you if need be. But there is an article talking more detail about that, about divvying up research studies and what's acceptable and what isn't acceptable. And in that case, what could have happened is we could have had 8 different types of evidence that could have made an overall difference to what we were presenting. So instead, what we did is we selected and said, this is the one piece of evidence that we're going to use that crosses all of those 8. So it's only one piece of evidence to include, because the other ones are part of it. So again, we're getting more into the minutiae of when you come in to do systematic reviews and things like that. So just be mindful of that sort of thing. So again, in terms of, you talked earlier when you gave your feedback about, it's all about, the guidelines, making sure that we take care of our participants, our patients, that actually we have gone through a procedure, we have got ethics, we allow for their anonymity, you know, how are we going to do that, which again you'd need to put through in all of your ethics. We want, you know, we're assuming that if somebody's got ethical approval, that has been covered when they apply, so that ethics reviewers will have gone through those things. They'll have looked at the consent forms and all the other information. You don't need to get bogged down into that detail. If it says they've got ethical approval, that's good. That's what you need to see, but also the process that they've gone through. So in terms of journal ethics, so again, in terms of publishing, you know, we do have some very clear oversights about what we're wanting to look for. So we want to see that actually they have got ethical approval, and where was that gained from. So that might be a university or an institution or the NHS, for example. We do want to see how they've gone around their consent and how they're providing confidentiality and anonymity. But also we want that transparency about how they've done the procedures. And again, there's a link on here for Plus about how you can check that as well. So again, some useful resources on there for you as well. So it's not a task for you to do now on this call, but just thinking about afterwards, if you want to think about in your own area, I've given you some food for thought about journals and the sorts of things that you might want to think about in terms of ethics. So think about your own research area and topic of interest. And again, looking at your questions this morning, you know, we've got people from a whole range of different clinical settings and interest areas. So think about, you know, if you were to look at, you know, sort of 5 journals in your area, okay, what have they included in terms of ethics? What's been required from the journal? Look about, you know, are they all international or are they just within the UK? And that's absolutely fine. Journals often are very specific to a type of profession or a particular discipline or in terms of a methodology, etc. But, you know, are they international or not? Not that that's not an issue in terms of if it's not, but are they peer reviewed? In other words, people that are reviewing it that often are blinded. Some journals will ask you whether you're happy to disclose who you are in terms of sending it back to the authors, but absolutely peer reviewed. As a standard, that's 2. For our journal, I'm housed under Elsevier, who have hundreds of journals, including the Lancet. You know, we have a minimum of 2 peer reviewers. If we can get more, then that's fine. But sometimes the more people in the mix, they all have different views. So 2 normally, and the editor, the handling editor, will make an overall view and decision. But also look who's on the editorial board. Do you know them? Are they leading experts in your field? Do you know them? And this will become very apparent when you look at predatory journals as well. So who are they? Okay, and also what's required under the author guidelines. You know, every journal has a list of what's required in terms of the guidelines, okay, in terms of what types of articles they'll accept, but also what's required. So again, you know, if you see things around the ethics or how much they're wanting, you know, it's not certainly going to be a line. Also about limitations, that sort of thing as well. So just have a look at in your own area after this session, so it'll give you a chance just to see, well, what else is in my area that I should be expecting to see. So let's move on to think about the actual tools themselves. So again, I'm doing this from 2 angles. This is about the tools that you could use when you're in your own research. So you've done a study, you want to publish it. One of the things that you can use is a number of tools that demonstrates how you've gone about your research study, and you include that in your manuscript to say that you've used a CAS tool or whatever tool it might be that you've used is appropriate for the type of methodology that you've used for your research. Likewise, this is what you can use when you're reviewing the evidence that's out there. So whether that be conducting a literature review, scoping review, systematic review, etc. But you can use these tools as a form of critiquing and assessing the actual, what you see in terms of the paper itself. And often, a bit later on we'll talk about, you've only got what's presented to you. Yes, as a researcher, you might want to delve a bit more, and sometimes you might want to contact the authorship team because you just want to clarify something. But again, you wouldn't be contacting them just to say, I noticed you didn't include your ethics approval. Please, could you tell me what it is? Because that makes no difference to you assessing the study that's been presented to you. You just need to use a range of different tools to be able to do that. and you agree that from the outset with the team or yourselves. I know somebody published up that you've got a journal club, and again, you want to use this in terms of thinking, you know, here's a paper, we're all going to go off, use this tool, and then think, oh, actually, that's interesting, and have those discussions. Oh, you said you thought it was okay, but you thought not quite so much, you couldn't find something. Yeah, so that's what you use it for. So you can use it in two ways. So I'm going to put you, Alice, I'm going to put you back into breakout rooms for a short time, because I'd like you to make a list of all the tools that you are aware of that you've either used or you've come across in your time. And we'll either have a very long list or we'll have a very short list. So I'm just going to give you time just to go into a breakout room, Alice.
Okay, how long for?
Just 6 or 7 minutes.
Okay, bear with me.
So I want you to think about, and you'll probably go on into different groups as well. So you'll have chance to do a bit of networking again. So all of the tools that you are aware of, you may have used or you may have seen in a journal article, or somebody may have mentioned it to you. So let's see if we can have a list of those tools that you're aware of. In terms of tools, there's just one question. A question came up about different types of reviews. So just to say to you, when I talk about a review, it could be a whole range of reviews, and I'm not going to go into any detail about the different nature of that. That's a different session altogether. So it might be a lit review, scoping review, systematic reviews. It could be a rapid review. It could be an umbrella review. So we'll just say reviews, okay, in terms of when you're maybe conducting a review or it's something you're thinking of. So I'm sure you can see on here, there is a whole range of different tools. So again, for some of you, you've already identified CASP. So CASP is a commonly used tool. It's fairly easy to use, which is always great. What you don't want is reams and reams of stuff and thinking, you know, cracking, being asked lots and lots of questions. So it is an accepted tool that you can use for appraising the evidence. And again, the neat thing is that it's free, as most of these tools are, but it's been around a while, developed in Oxford in the UK in 1993. There are 8 different tools depending on the type of study that you're wanting to check the evidence against. So whether it be a systematic review, an RCT, you can see the list on there. Qualitative research is used a lot. So again, there's a whole list of there, all there with hyperlinks. And again, some of you asked me about different questions and different terminology in the chat. If you look on the glossary of terms, that's a really useful one, because again, we often throw in different terms that you're thinking, oh, okay, it says a cohort study. Let me just check what that might be, or a cross-sectional study, or yeah. So again, really useful, particularly not even just when you're starting out, but just if it's something that you're not familiar with, that's a really helpful, useful tool. So I'm glad to see that some of you are already aware of that and have perhaps used it. So there's no issue there. You can use it. It's easy enough to work with other colleagues that are not familiar with it. It's very self-explanatory. So, you know, definitely I'm an advocate for CASP. Another tool that I must confess I haven't used, and it's got a funny acronym of RATS, which seems interesting itself, but it is a BMJ tool. And I have, if we've got time, I have got the, I'm going to pull up the checklist for you. And it's a really neat checklist, actually, for qualitative research. And as I say, I've not used it before, but I'm certainly going to have a look at it myself, actually, now that I've come across it. So again, again, it's just a matter about your own personal preferences. You know, what is it that works for you, that you find is in a format that works well for the types of studies and evidence that you're looking at. And again, what you can do is use a couple of the tools for a couple of papers and just test out which one is easier for you to fill in, which one seems the most comprehensive to help you to answer those questions about the actual evidence that you see. So you've got the RATS one I've mentioned. In terms of reviews, obviously I'm a JBI reviewer, so I've got to include that in there. But again, JBI have a range of critical appraisal tools which are all free to download. And again, it doesn't mean that you have to publish your work in JBI, but it is a tool that you can use. And then when you're disseminating your own research, you can say that you use the JBI checklist. Or also if you are producing a review, then you can use it in that way, that you use a JBI and whatever the tool was, and the number of people that were using it. Cochrane, obviously Cochrane is always seen as the gold standard, particularly around RCTs. So again, there's a lot of evidence around there. They haven't really moved into qualitative research, so that's where JBI neatly fits into there, although there are other portals that can be used. Amstar I've not used either, but again, that's really for when you're completing a review of a review, often called an umbrella review. So you're getting all of the reviews together, so all the systematic reviews together, and you're reviewing them collectively. And you'd use that checklist. So I'm hoping you're gathering already. There's a whole range of different tools that can be used here. So slide 2. So in terms of mixed methods, again, I have used this tool. So we were doing an assessment around, we were interested in the types of communications that have been used within care homes. And we were using this on the basis that we were conducting some COVID related work within care homes. And what we were interested in is, before the pandemic, what was the evidence about the different mechanisms and tools that were being used to communicate between a care home, relatives and residents. So we were looking at any type of evidence, whether it be mixed methods, quant or qual. So how are we going to be able to assess all them? Yes, we could use CASP for the qualitative stuff, but we wanted to use one tool that went across all of the evidence that we would be able to obtain. And so we use this tool, Mixed Methods Assessment Tool. And again, it's free, very user friendly. And also later on I've given you some journal articles that talked about the use as well, but these are the actual tools themselves that you can access. If you're doing anything around RCTs, then Consort is the way to use that, and it's an accepted tool that's used for RCTs. Likewise, the Strobe, and also interestingly, I came across Moose yesterday, which I've not used because I've not done these types of reviews, but again, some of you may be familiar with that. And again, these are all readily available. Just do the Google and other search engines are available. And again, Agree is a tool that's often used when we talk about practice guidelines. So again, often NIHR as an awarding funder will use this as a form of looking at what is the evidence. I've lost my slides. Let me just go back on. Yeah. So again, that's another one. If you were just looking at a particular aspect around the guidance that's been given, and again, I'll put one up in a second, which is around NICE, in terms of a tool for them as well. And also, as I say, NICE, we have this in terms of for qual appraisals, a different system. And again, so there's different ones that are available. Let me just come onto the chat function and just see if there's anything on there that I haven't used. Someone wrote on there about the Ottawa. Yeah, okay. Let's look. Mass Prism. Yeah, Grade. Yeah, Grade obviously has been used. I've got some further references in a second for you. Axis, Cockroach. Yeah, so lots of different tools that you use. I mean, the main thing is that you're using consistently the same tool, and that's what you need to be looking at and thinking about. How have you done that? Because that, again, if you're using this and then you're going to publish that work that you've done on the evidence, then they need to say, well, how have you done it? What system have you used to assess the evidence? So that's brilliant. Okay, excellent. So again, some of you may be familiar with Consort, but I just thought I'd give you an example of the sorts of questions here. So again, all of you that will be reviewing would have a copy of this, and you'd go away individually and you'd review the paper, and then you'd follow the same checklist. And you'd be going through, okay, things like this. So again, really helpful. Again, titles and abstracts, the amount of time that I review a paper, and it's only because I then read the rest of it that I think, well, that doesn't say the same as what's in the title, let alone the abstract, you know. So, you know, if you're selling different types of baked beans, then put that in the title. Don't let us have to read the whole article before we realise this article is about baked beans. So your title and your abstracts are really, really important. And particularly if you're looking at the evidence because you're going to put it into some form of review, then the first screening process is the title and the abstract. So if you can't see, you know, what it is that you're wanting, then you'll say no, yes, no, not sure, unsure, etc. So it's really important that the title and abstract is very clear about what the article is about. And often as editors, we actually do make that suggestion to people. So the study is great, and the abstract may need some tightening up, but we actually do make recommendations that actually the title is amended to reflect what this paper is about, because that way you're going to not only get more hits, but also as well it's going to be of more use for people that are looking for the evidence. Same with keywords. So you can see the sorts of things here that you would be assessing in terms of that particular paper. And again, when you come to report it, you might see something like this within the actual paper itself. So this shows how enrolment, allocation, etc. for an RCT was conducted within a study. So again, you're wanting to see that. How has that work been undertaken and in what way? So again, these are the sorts of things that you'd expect to see. And if you're not seeing things like this, then again, you start asking questions. Okay, and as researchers, that's what you're at liberty to do. You want to know, you want to be testing out, is that evidence as it appears? So again, how you might report this or what you might be looking for. So when you come to review an article, and as I say, I'm particularly talking about articles because that's where we tend to talk about the evidence. Okay, so what you might see is some of the examples that you've got here. So again, the systematic review, what have they used in terms of the reporting of what they've identified? And the fact is, was it or was it not registered? Prospero, as some of you may or may not be aware of, is a free registration based up at York University. So if you were doing some form of review, then your protocol for undertaking that review should be registered with Prospero. And again, if it is registered with there, which is highly recommended, then you include that registration number on your published work. So you register your protocol, what you intend to do, what the stage is, what you're wanting to do, and then when you come to you've conducted the review and you're publishing it, you would include the fact is that it's registered and the registration number. And that's interesting because often we will go back to Prospero and check what it was they said they were going to do, and is that what they are reporting in this review? Okay, so again, if there's big differences, then again we would not send it for peer review. We would reject it with the reasons why we've rejected it. So again, you know, helpful for you in terms of creating your own outputs, in terms of registering, and also, you know, it lays a marker down that actually this work has been undertaken. So if you were thinking of, well, actually we're thinking about doing something around, I don't know, dementia in sub-Saharan Africa, if you go on there and search on Prospero, you'll find that actually there's one in there because I've got 2 registered with them. So again, you'd then be thinking, oh, okay, I wonder what the progress is. I might contact that team. Rather than doing the same. Let's see what it is exactly what they're doing. Let's have that discussion, how far they are, etc. So good practice to do that. Again, you can see here the second one about eligible studies. It's actually telling you how they've done it, how they've gone through the processes in terms of a review, in terms of how things were extracted, how they were reviewed, how discrepancies were resolved, etc. And these are the sorts of things that, you know, you'd want to be able to see. And again, same with an RCT. Again, they've used accepted different tools in order to include that within the journal article. I mean, there's lots of other examples, but I just picked up a few there just so you can see the type of thing that you should be expecting to see in articles. The grey literature, let me just see if you're all still with us. Yes, you look like some of you are still with us. That's good. That's good. So the grey literature, you'll be pleased to know I'm not going to send you out into a breakout room, but if we're in a room together, then I might ask some questions of you, but we don't have that opportunity with time, etc. So the grey literature, it is really referring to any other literature that's been produced. Now that might be a report, it might be charity reports, it might be guidelines, it could be anything that isn't it got in the traditional publishing distribution channels, i.e. it's not in a journal. Okay, it might be conference abstracts, it might be symposium at symposii, at conferences. It could be a whole range of things. Also master's theses would also be included in there as well. So as it said here, it's information produced on all levels of government, academia, business, industry. It could be in electronic format, most of it is nowadays, or print format, but it isn't controlled in any way by commercial publishing. In other words, it hasn't gone through that peer review process. Okay, so it's a different type of body. That doesn't mean that we would exclude it. Depending on what it is that you're interested in, the grey literature might be where the only evidence is. Okay, and that's where you're going to need to look. Or, for example, we in Brazil, students undertake a master's degree for a minimum of 2 years, and there's a lot of work that they've undertaken because they have to undertake a long piece of work study, either reviews or actually empirical work. But often that work is not published in the traditional sense through journals. So, but their master's theses are available, but they're within the grey literature. So when we were doing this piece of work about the different tools that are used for assessing of older people in care homes, we actually wanted to go into those theses classed as the grey literature, because that's where we knew there was a lot of the work around this area. So again, you need to think about, well, do we need to include it or not? I will give you a health check. If you open up the grey literature as well as the current normal literature that we're classing as journals, etc., you will have a plethora of research. Okay, so trying to combine the two, you'd really have to think about, well, why do you need both? If there's a lot of evidence in the existing literature, you don't need to be then searching the grey literature. If it's something where you're thinking, actually, what we do need to do though is we're searching the current evidence, but also we're interested in perhaps charities policies or other types of work, just to see what the differences are or whatever it may be, then that's fine. But trying to do both in the same scale, I would suggest is not going to take you 3 months, 6 months. You could be looking, a year or 2 years. So quite a long process, depending how many people you've got on your team. However, you will be pleased that there is a checklist, and I've put the link on here. So I don't know if it's got an acronym, but it's AACODS, you can see it on there, okay, is used so that you have a process in there to be able to critique the grey literature as well. So again, there are those things in place. And you may or may not be aware, but there is a number of sources that you can use. I've just used this one on here, where you can access all of the grey literature for free. Okay, but this will include everything in Europe as well. So be aware that if you put in quite broad searches, you will get a mass of information. So you need to be careful about what it is that you're particularly interested in. But again, it might be something that's of interest in your topic area, that you're interested in a particular thing that happens in certain countries, etc. Okay, so again, useful information, just being aware of what the grey literature is, and the fact is that it may have a place within your own context. Predatory journals. I would ask you at this point if anybody's aware of predatory journals, but for the purposes of me just delivering this online, predatory journals really have come into the fore in the last 6 to 8 years, I would say. And I'd be really surprised if none of you have not had an email that says, "Dear Professor," or "Dear esteemed colleague." And straight away when somebody does that, I'm thinking, well, I'm not a professor, so they obviously don't know me. And also, why am I esteemed? So you can normally tell when you get these predatory journal invites. And basically what these are is, these are journals that are not listed under Scopus. They're often, and the majority of times, not peer reviewed. They're not necessarily housed within any publishing. They are journals where they may offer you to publish your work for free. They have no impact factor. And I know one of the questions that somebody put in the chat is about impact factor. So impact factor is basically a factor. If you do a Google search, or I'll put it onto the slides after the session, the impact factor is basically a number that is derived from the number of publications in the previous year and the number of citations of that work. So for example, my own journal has an impact factor of around 1.6. In other words, the number of articles that we've published in a year against the number of citations against those articles. And that's then converted into a number. So somewhere like Nature, somewhere like the Lancet has massive high impact factors. And again, you know, the gold standard, if you like, for us in healthcare would be to publish in the Lancet, for example, or even some aspects of BMJ. However, it's about getting that evidence out there. And if you're wanting to get it to practitioners, then it might be that actually the practitioners that you're talking about don't have access to the Lancet, but they do have access to their own professional journal, and that's where you might want to put something in there. And it may have a much lower impact journal, or it may have no impact journal at all. And again, that's fine. You know, every journals, when they first get instigated, have no impact journal because it takes that time to get it. So again, it's those decisions depending upon your team where you're wanting to put your work. So again, a broader discussion than what we've got on this session, but I'm hoping for the person that asked that question, that's kind of helped you. But I will put something up on the slides later on about impact factor. So yeah, so often they'll offer you a whole range of things and we can peer review it. They'll say they peer review it and we can get your work published in 2 weeks. Well, first of all, I would be querying how they're going to do that in a meaningful way. So a lead time for most journals is accept open access, where you've normally paid to have open access. In other words, once it's accepted, it gets put online. But normally you're talking anything between 20, 30 weeks, sometimes up to a year from when you initially submitted to having the peer review process, getting that feedback, you making the amendments, you're sending it back, it gets re-peer reviewed, and then it gets accepted. So you can imagine, you know, each peer review in our journal, we allow 4 weeks. We give a reviewer 4 weeks to review that article. If they do it the next day, that's brilliant. Okay, but again, there's a time scale. So if people for predatory journals are offering that they'll have it out and, you know, your work can be out there in the next 2 weeks or 3 weeks, then I would be very concerned in terms of where it is. However, you can check. There is a website called Think, Check, Submit that will help you. It lists all of the journals and it'll be able to tell you by you putting the journal title in whether it's a predatory journal or not. So that's really, really helpful. I would say as well that also there are also predatory conferences as well. So just be mindful that you might get asked to submit your work, you know, or very eminent work, please come and present it, you know, and they're always normally in very exotic locations. So again, you know, there is websites so you can check that as well. So just be aware of that, because again, when you're doing your searching, you might come across some of these articles within your searching. And again, if you're reading an article, you're thinking, there's nothing on ethics and they haven't mentioned about process and it seems a bit odd how they've conducted the study, and you've just got that gut feeling something's not quite right, you can run it through here and it'll tell you whether that journal is legit or not. So that's really helpful. I'm conscious of time. We're nearly there with the slides. So in terms of preprint, I'm going to come on to see you in person. So in terms of preprint, is anybody aware of what we mean by preprint manuscripts? Has anybody come across preprint manuscripts? See a few shaking of heads. Anybody? Okay. So
is it where they outline the study of what they're going to do but don't include the findings because they've not done it yet?
No, thank you, Olivia, but the answer is no, it's not that. But a good stab at it, thank you. Okay, often that's to do with protocols. People will publish their protocols about this is what we intend to do, etc. So that's slightly different. So you can publish protocols of your intentions, okay, and some journals will accept those protocols as well. So that's good, because I didn't mention that, so that's excellent. So that's another thing that you might come across. You wouldn't include that, okay, in terms of your evidence, but what you would do is say, there's a study that's either been conducted or it's saying it's going to be conducted. You'd then be looking then for the output. So where's the evidence from this study? Because it might just be a protocol. If you're doing any form of review, you wouldn't include a protocol. But you might say you are aware that actually there's some work being done in this area, okay? Or you might contact the team and say, you know, I've come across your protocol, has this work been completed, etc. Okay, so a preprint manuscript, these are fairly new, I'd say in the last 2 years. And what this is this is manuscripts that have been submitted to a journal. So they are ready. They've been submitted, but they've not been peer reviewed. And so there are hosting sites, and they're all legit, where you are allowed to send a preprint version. In other words, it hasn't been printed, it hasn't been peer reviewed. Now, currently, there is quite a debate about whether we should be including them in reviews, because again, they could, it could get rejected. So one of the issues is you also get an ISBN number for it. So you get a DOI number. So actually it's there. It couldn't get taken away. So you might submit it and it might get rejected, but it's still out there. That study. Okay. So you just need to be mindful of whether it's a preprint or not. And the advice at the moment is that we don't include them in the evidence. We might need to be aware of them, and then we do the trail of following on. Well, when was this submitted and where's because you'll actually get two. You'll get the preprint version, then you get the version that's been accepted by the journal and it's been peer reviewed. So the journals themselves are not, so don't accept it. It's a different type of housing of where they accept the preprints. Okay. So again, just be mindful of that if you come up, but it will say preprint very clearly on the manuscript. This is a preprint version, so it has not been peer reviewed. Bye to those people that are having to leave. That's fine. Thank you for attending. Okay, so in terms of preprint, just be aware of that. And then you'll be pleased to hear I've then got 4 or 5 slides, which I'm not going to go through in detail, but you're going to get them shortly. This is a whole list of other useful resources that you might want to be aware of. So the first one is 2 really great short little videos from Cochrane telling you what systematic reviews are. So they're really helpful if you're thinking, crikey, I'm not really sure, am I doing a lit review, or what is a systematic review, when would I need it, etc. So have a look at that. Also on JBI, so the Joanna Briggs Institute has also produced 6 really neat videos around conducting critical appraisals. So again, it just tells you about what to do, how to do, what we would do. So again, have a look at those. Those are really useful. Again, some other resources here. This website here for the grey literature has been produced by Librarian Guides. And on there, it tells you a whole host of things about grey literature, what we mean by it, how you can use it, the different sources, etc. So that's a really useful information if you think you're wanting to use that. And then just some articles really about using how to do critical appraising, how to use different tools in order to use it. So again, helpful for you to think about, okay, what is it that I'm trying to do? And if it's a systematic review, what sort of tools might I use? Again, a whole host of other articles that have been produced around the different appraisal tools that can be used, which ones to use. We talked earlier about critical appraisal tools by JBI. We've also talked about the mixed methods appraisal tool. So again, this tells you they've done an appraisal of that particular tool. So that's a really neat read actually, because it actually tells you about some of the limitations so that you're aware of that. The actual tool itself, as I already said, is free to download anyway. Something there about CASP, which again, quite a number of you are aware of that, so that's a useful one to have a look at, and also by Prisma as well, some information. And the list goes on. So again, other sources here for you, which again, in your own time, you can just have a look at. And then again, just some other types of information if you're interested around, even though it says JBI, the principles fundamentally are the same. It's a systematic, rigorous approach to reviewing the literature. So whether it's Cochrane, JBI or other sources are available, then the principles are the same. So please do have a look at that. And the last link on here, if you're thinking you might want to do or need to do a systematic review course, which is a validated course over 5 days, which gives you the tools to do qualitative, mixed methods and quantitative research systematic reviews, then we do run a course at Nottingham which you have to pay for, but we do run a course, and we've got a course in July, so there's a bit of a plug. And then last but not least, which is just about on time, an open question: what have we missed? So I'm hoping, I'll just come back to you, I've ticked off the bit about the impact factor. Somebody asked me about IRAS and REC, and again, I'm hoping we may have covered that question. So IRAS is the system that they use for you to get your ethical approvals through, which will either be through the Health Research Authority and then also REC, so the NHS approvals within the setting where you're doing. So if you're doing work in Lincolnshire, then you need to get REC approval from Lincolnshire NHS or Derbyshire or wherever it may be. So those are the differences between them, what we mean by those two terminologies. So I'm hoping that helps. And somebody's mentioned about ethics, routinely collected data. Okay, so you're routinely collecting data about your patients in a clinic, but for the purposes of what you're using, you haven't got ethical approval from them patients to use that data, only for the purposes of their medical condition. So again, you do need ethics to be able to access and use that data and then to publish it. So you do need to get some approvals for that. I've got an action for me which says you want to have a look at the article around salami slicing, which I'll identify, may not be this afternoon, but I'll identify and add on. And this is where people have used more than have divvied up. So imagine salami slicing, their research study into lots of very small components. That's fine if it's different work streams, because you've got different work streams that are doing different things. Let's say it's a study that's doing interviews. And then you find that the actual interview data, the findings have been, oh, well, we're going to present, this theme and then another paper with another theme. That's salami slicing, and that's a no-no. Okay, and all journals are aware of that, and we have mechanisms in place to check what's already been published. So it's quite nifty. Online technology is brilliant, because we didn't used to have any of these things in place. But people are getting more and more, we have to be one step ahead of the game, let's say. Doesn't mean we're perfect all the time, but that's there. So I'm conscious of time. Would anybody like to ask any questions or anything? Please just unmute yourself and fire away. If I can't answer the question, then I'll see if I can put you in touch with somebody that can. Thank you for those that are having to leave. Thank you.
Hi, Catherine. Just a quick one. When you were talking about Prospero, I was wondering if after publishing a protocol on Prospero, if before you actually start the review, you have some amendments to make. Do you have to amend the Prospero submission as well?
Yeah, you can go back to them. It's a very simple process. You just ask for an amendment, so that's fine, no problem. Yeah, good question. Thank you. Thank you. I'm glad you found it informative. Yeah, I'm sorry it's been a massive whistle stop. There's so much to cover in here. I mean, you could cover this in a week's course. A day on ethics, a day on this, and then some practical things. So I'm sorry it's a bit of a whistle stop. And again, when I was starting to put together the session, I'm thinking, oh, crikey, there's loads of stuff here that I want to include. So, but hopefully it's given you a flavour. Hopefully it's answered some of your questions. I'll send over the slides, as I said, and I know Alice is going to send over the recording once we've edited a few bits in terms of the pregnant pauses, and also the slides. It's got my email address on there. I'm more than happy for you to contact me. I don't mind, that's fine. Anything else? Anybody else? Can you get ethically proven? No. Question there. Can you get ethically proven in respect of a study already started? No. Okay, you'd have to have very good reasons as to why you've started a study and now you're applying for ethics. Let's say it's changed and initially you were just going to interview work colleagues as part of a service evaluation. So service evaluation is in-house, no problem, that's no problem. But from that, you've realised actually there's some things here that you want then to develop. Then you could apply for ethics, but you can't do something and then think, oh, I should have applied for ethics here. You can apply for ethics, but obviously all of that data beforehand, you cannot incorporate in there. Does that answer the question, Mary?
Yes, it does. Thank you very much.
Oh, you're welcome. No problem.
How
do we evaluate if the stats have been correctly, if critically appraised any references? How do we evaluate this? Oh, that's an interesting question. Well, Catherine, I'm not a quants person, and anything to do with numbers, I normally run to the other side of the room and hope somebody else picks up. So that's where you'd have statisticians, you'd have people within your team that are experts in that, and they will be able to tell you, have they used the right formulas to actually assess those statistics, you know, so what have they used, what are they presenting, etc. Okay, so you know, if they're saying they've used, oh, I don't know, I can't even think of something off the top of my head, but a particular term and often I send these out for reviewers, and they'll come back and say, actually, I've got major concerns, they've done this but they haven't done X and they haven't done whatever, so we just send that back to them. Okay, so if you don't have that expertise, that's absolutely fine. Then, you know, get hold of people that do know, that can review that paper for you. Okay, so I hope that answers your question, Catherine.
Do any of the appraisal tools have a question category on, is the analysis appropriate?
Yes, absolutely. Yes. Yeah.
Right.
So you can use that as well. So again, if you know you're thinking, oh, actually, I do know about this and this doesn't seem right, then you then would put that on there as a notation. So when you come together, you can all discuss it. Yeah. And ultimately, if you're using it as part of a review, your question is, okay, if we take this study out, does it make any difference to the overall findings or not? And you just make a pragmatic decision as to whether include it or not include it, because that's what ultimately you're doing, because obviously your review is presenting the current evidence to make change. So again, would it make any difference or not? So these are the sorts of questions that you need to do. But if you want to know more details, you need to go on a systematic review course, which is not in this session today. But yeah, I'm just checking back before I log off that there's nothing else. Thank you for all your nice comments. That's really nice. Thank you. Okay, hopefully I've not sent you all off into a whirler thinking, how do we check that it's an appropriate analysis when critically appraising a paper? Any refs? Oh, Catherine, that was what you asked, I think. Yeah, I think I've just answered that. I think everybody else is just, yep. So unless there's no other questions that anybody's got burning and wants to pose before we all go for a comfort stop, you're welcome, Olivia. Okay, that's brilliant. Okay, well, what I'll do is I'll leave you to go off and have a comfort break, have a break before whatever you've got on for this afternoon. I'd like to thank Alice for being my my helper, co-supporter, and also for organising all the admin for this session, which I think has been really good. Well, from my perspective, it's been excellent, and I hope that's the same for yourself. Please do come along and join us. I know there's a whole host of sessions that Alice and the team have been delivering, all online, I believe. So please do feel free to join any of those. And please feel free to leave whenever you're ready. Take care.